Welcome everyone to our monthly chat, and today's topic is organ donation. And to be more specific, April is National Donate Life Month, and today we'll have a packed program on transplantation, and you'll be hearing from our kidney donors, our recipients, and also healthcare providers. My name is Anjay Rastogi. I'm from UCLA, a nephrologist, and heavily involved with what we call advanced kidney disease care, whether it be dialysis, transplantation, and much more. And today we have some special guests, but before that, some background information. Number one, a disclaimer: the information that we'll be sharing is for your information only. Please do not make any changes in your care till you speak to your healthcare provider, because they will know your case the best. Also, some of our contact information. This is our first is our direct office line, 310-954-2692. Our email address that comes to the whole group is corekidney@mednet.ucla.edu. Visit our website if you haven't already. Just 1 second. And also, I think somebody asked about the Facebook page. So that is our Facebook page. Please do visit. We do post a lot of very useful information on our Facebook. So what is our goal at Core Kidney Program? And our goal is to make the patients their own best advocate. But how do they become their own best advocate? And that is by education and by knowledge. And that's the whole purpose of this event today is, and all the events that we do, is to arm you with information, with knowledge, with points that you can make the best decision. And that really is the basis of what we call the shared decision making. And today I saw a patient in the clinic today, and what I told her is the way, at least for me, the relationship between a patient and a provider is about a partnership, and you work together. But also it's our job as healthcare providers, and that's why you come to us, to give the best medical advice that we can give you, and then make sure that that works for you in your best interest. And that's what we call shared decision making. But being your own best advocate, there is no better advocate than yourself, because you know your body the best. So this is our Circle of Core, our patient advocacy and support group. You have seen this picture several times. This group keeps getting bigger and bigger, but everybody who's on this collage is just an amazing human being, just great people. And why are they so great? Because they are selfless. It's what we call unconditional. They are there to help and provide and share what they've been through. They are recipients, they're donors, they're patients with genetic causes of kidney disease. They are people who are in clinical trials. They are more than willing to share and help you out the best they can. So we are very, very grateful to this group. Now, some important upcoming dates. Every first of the month, just put that in your calendar. It's a monthly chat, 5 p.m. It's Pacific Standard Time. Also, we're doing a community event on June 25th. It's at San Fernando Valley Health Fair, the heart of San Fernando. And I'm not sure why it calls heart, but it should be called Kidney of San Fernando Valley Health Fair. So we'll be having that on June 25th. And the other thing that the Core Kidney Program will be participating this year is a Transplant Games of America. And Mark and Andy Green will talk to you a bit more about that. And if you can join us, please do so. These will be happening in San Diego. With this, I want to introduce my co-host, Mr. Mark Coronel. Was a boxer, and then he was boxing for his life. But he won. He won as a boxer, and he won this fight against kidney disease. And this is Mark, and this is our other very, very dear Circle of Core patient advocate, Gerald. And here we have Colleen, and you'll be hearing from her as well. She's a kidney donor. She's a voucher kidney donor, and she'll be sharing her information as well. Some more pictures before I hand it over. This is Mark Coronel as a boxer. His story is shared by UCLA Health. So if you haven't seen it, please do so. And here he is with Mr. Bean and the Core Kidney logo. So with that, Mark, I'll hand it over to you and you can introduce our special guest today.
Thank you, Doc. Thank you so much. So for everybody who doesn't know, our core kidney team is compiled of a recipient, a donor, a caregiver, just to name a few. Now, our goal here is to emphasize that hope for you guys so that you know what really happens with the core, with your actual kidneys and the full process. But just a little bit of a background of myself. Here I am with my donor, and I'm so excited. Today is National Donor Month, and she's calling in from Japan, and I'm so happy that she's on today. But here is what it looks like post-kidney transplant. I think this was 24 hours. If you look to the upper right, I was hurting so bad, and she came downstairs to give me a hug, and it was just one of the most I can't even explain type moment where I was just so grateful, right? And people who have gotten a kidney from a live donor, you just don't know how to say thank you enough in a situation like this. So a little bit of a background: I was a former amateur boxer. On my routine physical to turn professional, I found out I had kidney disease. My life had turned around. It went from fighting people to now fighting for my life, and that battle had completely changed. Through the process for about 8 years, I was fighting, and I had no signs and symptoms till I ended up on dialysis. And I was working with a team of and with a nephrologist, and he says sooner than later you'll end up on dialysis, and he was 100% right. So, and I'm very thankful that I did have a team to help me understand my diagnosis, number one, and to have me inconsistent so we can see where my labs were. From then, I ended up passing out in the bathroom. I literally fell on the floor. I had my fiance, Cindy, who actually found me on the floor, and we rushed straight to UCLA. Then I ended up on immediate catheter, and I started dialysis that Monday. Now, the story started for me there, right? I used social media. I went onto Fox, and this is what our program at Core Kidney emphasizes, is to be an advocate for yourself. And advocating for yourself is asking the questions, meeting with people like Gerald, like Judy, like Brock on our core team, and reach out to us to understand the process of what it's like to either be a donor or recipient, so you as a patient can also get the understanding to inform people who would like to donate to you. So I was on dialysis, and I used social media, and my sister reaches out to her very good friend, Shauna Robinson. Now, to my understanding, she was a bone marrow donor, and she said, you know what, I'm willing to donate my kidney. So she went through the process. And through the process, we were at one facility, she was denied, went to UCLA, best hospital in LA, I think in the nation, and they approved her, and we went through the process. Now, what that process consists of, I'll let her come on and share that story, but I'm just really thankful and grateful to bring her on National Donor Awareness Month. And Shauna, please come on now. I would love to share you with the world so that everyone can see. And I just want to say I'm so thankful for you. You are my angel, my hero. I love you so much, and just thank you for everything you've done for me, but not only have done for me, but to also show up for myself. So I thank you for that. So with that, I'd like to introduce Shauna Robinson, ladies and gentlemen.
Good morning from Japan, everyone. I'm excited to be here with you. I am eternally grateful for this journey, and it started from a text message from Mark's sister. Mark's sister and I went to high school together, and we're still best friends. And she was letting me know that Mark was going on dialysis and that he would be listed for a kidney donation. She sent a text message to a group chat that we share with another friend of ours, and I responded immediately that I would get tested. I wasn't aware of what it all entailed, but in my mind, I was always comfortable with the idea of donating a kidney if anyone ever needed one, anyone in my circle. And that happened to be Mark. And so initially, I called the facility and I went through a screener of multiple questions about my health and my family history and my background. And once I passed through that, then I actually came in and did a lot of blood work. And after that blood work got resulted, they found out that I was anemic, and I wasn't able to go further in the process because I wasn't healthy enough to donate. And so it was at that time that I spoke with my primary care physician, and they tried to give me iron pills at first, and they were making me sick. I couldn't take them, and I got really discouraged. And it was later on, I ended up finding out that there was such thing as iron infusions. So I had to take a couple iron infusions, was 100% healthy. Then after that process, I ended up having an MRI that came back clean. And then I had a full day of kidney donor orientation. I came into UCLA. There was a video that I saw. I spoke to a social worker. I spoke to a doctor. I had a CT done. I had more blood work done. And so there was just a battery of tests and communication and education and support, and just making sure that I was fully aware of what my options were. And then I got the amazing news that I was a match after all of that. And I was so excited. And right when I found out I was a match, I found out that I had a job opportunity in Japan, and they wanted me very soon. And my goal, my priority was to take care of Mark first. And I remember having multiple conversations with Mark's sister. And she was like, "Are you sure? Are you sure? Like, are you sure donating is your first priority? Like, let me know." And I was just like, "Of course, like, Mark is first. I would love to do both, but if I have to choose, Mark is first." And I also did a good job of communicating with the team at UCLA. Like, look, I have this dream. I want to help Mark. I would love to do both. Is there anything that we can do? And as it turns out, they ended up pushing up my surgery date in order to accommodate my dream. But most importantly, I told Mark that it was important that he show up for himself. And the reason why that was important is that by showing up for yourself, you allow others to help you, but you have to help yourself first. So, Mark, I need you to take your medication. I need you to go to dialysis. I need you to go to all your doctor's appointments, because you have a dream and I have a dream too, and we can help each other. And so thankfully, Mark showed up for himself. He was prepared and ready for surgery. And I know the surgery date kind of threw him for a loop because it was really soon. It was sooner than he expected. But everybody was trying to make everyone's dream come true in our situation. And we were able to go through surgery. Thankfully, I had no complications. Mark had no complications. And 6 weeks later, I was on a plane to Japan. So that was our story. Mm.
Thank you so much, Shauna, and we're so grateful your gift of life to Mark, who's giving that gift to everybody else. He's been at the front and center of our ambassador program. So when was the surgery, Shauna?
Our surgery was December 10th, right, Mark?
December 10th, 2019.
2019, before the pandemic. Had it been after the
literally
pandemic,
3
it would
months,
have been really interesting.
Right.
Yeah.
It was literally 3 months prior to the COVID happening. But I would like to also share, Shauna, what you told me 2 minutes before going into surgery. You even asked the doctor. I remember you asked the doctor and myself. I would love to hear, I would love for you to share that because it really resonates with me to always showing up for myself. But you said it in such a specific way that really resonates every time I show up for myself.
Mark, I'm gonna need you to remind me what I said. I forgot. What did I say?
You told me, "Are you here?" Remember? It was
Just being
literally
present.
right. So
Yeah.
you said, "Mark, are you here?" Because it took us so long to get to this very, very point. And then when we actually got our transplant, you actually also even asked the doctor that. Remember?
Yeah. Well, the doctor asked me if I had any questions, and I asked him, did he get a good night's rest? So I was just like,
That's what you asked him.
I just wanted to
Right.
make sure when you walk into a patient's room, and I've been on the clinical side as well, it gets routine to go in and ask the same battery of questions. And so I understood that he probably hadn't been asked that before. And I just wanted to make sure he was present and not just going through, what the usual questions that you go into each room and ask. It's just like, okay, are we here today? Like, everyone got good sleep? Okay, wonderful. Let's do this.
Right.
So,
Right.
yeah.
Yeah. So thank you so much. I really, really appreciate for that. I mean, the gift of life is so amazing. And every day I make sure that I utilize the showing up for myself every day, Shauna. So thank you so much.
Yeah, I mean, Mark, I still have some questions. So for Shauna as well. But first of all, the gift of life is self-evident. You don't have to say that, Mark. You're so full of energy and you're so giving so much back to everybody else. So Shauna, that's a gift that keeps giving. So thank you so much. But my question was that, I really like Oreos. I mean, I don't have an Oreo right now. It's just a cookie. It's from Girl Scout cookies that I always buy. But I was told that, Mark, you didn't like Oreos before, but now you like Oreo shakes for some reason.
Yes, I love Oreo shakes, Doc, and I asked Shauna several months ago because I was doing it 3 times a week. I mean, I was like, why do I like Oreo shakes so much more now that I didn't like before? And she said, you know what? I really love Oreo shakes. Now, I don't know on the clinical side, Doc, if we do get some of their traits like Oreo shake. I literally love Oreo shakes. Now on the clinical side, I'd love to ask you, Doc, do you get some of those traits and it does go to you?
I mean, how would I know, Mark? I
You're right.
didn't
You're right.
transplant.
Right. But yes,
It sounds
I
like a
believe
new
it does,
opportunity
because
for a study.
Yes.
yes,
We have a lot of
yes,
donors and
yes.
recipients over here. But I just want to say, Shauna, what a priceless gift. And, for you took time at your lunch break or whatever break it is in Japan right now at 9 a.m. to join us. I've heard so much about you. And didn't you participate in the run last year too, Mark?
Yes, she ran.
I sent in a video.
Yes. So, no, thank you so much, Shauna. And, bless you. You're just an amazing person. And thank you for doing whatever you did for Mark, because like I said, it's amplified 1,000 times what he's doing for everybody else. So thank you. And I hope you stay on for a bit, because I'm sure there might be some questions coming your way.
Definitely.
And do you want to mention what color dress you have on right now?
I have on green for Kidney Awareness Month.
Very good. Very good. Thank you, Shauna. So Shauna is going to be on. What a powerful story. I just, it's people like Shauna, and there are so many more that you'll be seeing today. But this is a priceless gift. But I do want to mention a couple of things before we get too deep into this. The living donor process, especially at UCLA, is very, there's very strict oversight. And I was a medical director for a very long time, and I just stepped down a couple of years ago. And the way we developed the program, it was donor centric. So if you want to be a donor, that's great, but you have to go through the whole workup. You have to go through testing. We have to make sure that you don't have significant risk factor that will put you at risk down for kidney disease down the line. So a lot of times people think that you just go in and you donate. No, that's not true. You will actually have to go through a full screening process to make sure that you are healthy for yourself. And now we can't predict what's going to happen 10 years down the line. All that we can do is know what we know now to predict and assess the risk of having kidney disease. I also want to introduce one of my colleagues. She's on right now, Dr. Sarkar. If you can come on the camera, Dr. Sarkar is going to be joining our faculty. Well, she is a faculty member, but will be joining us July 1st as our transplant nephrologist. She's going to be on these meetings. She's going to be answering your questions about transplant process, both from the recipient and the donor side. I know Dr. Sarkar is joining us from the Bay Area on her vacation, and this is how much this means to her. I called her today and I said, are you available? And she says, always, when it comes to patient, as long as Zoom, because I don't think she was willing to fly down to do this. So Dr. Sarkar, if you want to say hello to all of us, and thank you for joining us.
Well, thank you, Dr. Rastogi, first of all, and hi, everyone who's joining in from everywhere. And I also wanted to express a big thanks to Shauna and Mark. I mean, sharing the story that you share and the way you do kind of lays out how the process is, and like how it changes when you have friends and you get the support you need to go through this process. You've both expressed it in like great, kind, powerful words. And I would say, like, I'm here. I'm very honored to be a part of this program, and I'm here for everybody in all forums to help you out, understand the process, kind of understand what you don't see, maybe even like sometimes things get you only see the patient side of things. And with my training, I just want to say, like, please use me as a vehicle to understand the process, even from the physician side. And if I can answer, I would just like find myself useful. So thank you, everybody. Very honored to be a part of this team and very happy to meet you all.
And thank you, Dr. Sarkar. Like I said, you are one of the missing links for this program. So this program gets stronger and stronger as we go along. But the people, I also want to mention, people who speak at these programs are fully vetted. They are not just random people that we bring in. These are people that have time tested and evidence and science-based. So that's what Core Kidney stands for. Now, there are a couple of things I want to mention about Shauna. She did mention about the match. And that was great because Shauna was a direct match for Mark. But what you do have to keep in mind, you don't have to be a match anymore. There's a program called the paired exchange. So as long as you're healthy, you can donate. And even if you can donate directly to somebody, they will get a kidney from somebody else. And that's called the paired exchange program. So you do not, and I think that's really important to keep in mind, to be a direct blood group match with the recipient. Also, we'll be talking about the voucher program a bit. We have Colleen Flannery, but there's a question that is in the Q&A, and I think somebody did answer that already, or did they? One second. This was about, I think Dr. Sarkar is answering that. This is about polycystic kidney disease, but I'll also be going over that in some of the slides. So let's move to the next slide. Andy Green, I don't know if she's here. She's one of our amazing living kidney donors, and she will be participating in the transplant games along with Mark. We are all participating, but she and Mark will be leading it. So I don't know if Andy is here. If not, we'll move on to the next slide. And this is her again. And this is Mary Beth, our angel, Bill, and this is Andy and her recipient. And as you can see, my kidney, new kidney, is right over here. Now, going back to the question that was asked, let me give just a bit of a background. We all have two kidneys. They are in the back, right below the 9th and 11th ribs. They're about 9 to 11 centimeters in the longest dimension. This is the ureter, this is your bladder, and that's the urine comes out. So this is the kidney, and especially in the question that was asked about ADPKD. So the kidney size is important. And in most of the chronic kidney conditions, the kidneys get smaller, they shrink. But there's one condition called ADPKD, autosomal dominant polycystic kidney, in which the kidneys can become massive. They really, so from about 10 centimeters, this longest dimension can go up to 25 centimeters, if you think about that. So even though the size are big, the kidneys become dysfunctional. So kidney size is important. And how do we define chronic kidney disease? So first of all, it's chronic. So any evidence of kidney damage for 3 months or more will qualify and classify you as having chronic kidney disease. But how do we define kidney damage? You define kidney damage either based on GFR, which is below 60, to be qualified by itself, or any other evidence of kidney damage. And the most common one is going to be your urine is abnormal, including albumin and protein in the urine. Or there is something abnormal in the imaging like ADPKD. So you can have a normal GFR, and I think that's the important point, a normal creatinine and still have significant kidney disease. So this is an important point to keep in mind. Sometimes we just go by GFR or creatinine and we think everything is good. But to get the full picture, you should have a blood test, a urine test, and an imaging test. That will hopefully give you a more complete answer. The tests that we do, I've gone over this, but one point that I do want to make is everybody should look at their labs, be their own advocates, blood urea nitrogen, creatinine, eGFR, cystatin C, you'll be seeing this a lot more in the years to come. A urine test, we spoke about that, albumin and protein in the urine, imaging test, a simple ultrasound, and eventually biopsy. If needed, not everybody, but one test that I do want to put over here is gene testing, genetic testing. We have broad panel testing, and the question that you should ask your nephrologist is there a genetic basis of my kidney disease? And why is that important? Well, obviously it's important for you because, hopefully there are studies and trials going on and getting the accurate diagnosis, but don't forget other family members, including your own kids, that might be at risk of having a genetic cause. So ask your provider that if there is, and if there is, you can email me. We put in the core kidney at MedNet, but this is a very fastly developing field about broad panel gene testing. And this is also important when a family member wants to donate their kidney to their loved ones. So what's not mentioned over here is what we call broad panel genetic testing for our kidney patients. Well, it is mentioned. I apologize. So the genetic testing is critical. This is how your blood work looks like, your sodium, potassium, creatinine. We most likely will be dropping the race-based GFR reporting. So this will be coming soon. And then these are all the other tests. This is just a prototype. If you, your lab might be reporting it in a different way, but this is, you should know your labs, you should know your normal values. Like I said, be your own best advocate. Causes of chronic kidney disease, diabetes mellitus, especially type 2, is by far the most common cause. Hypertension, we don't know if it's a cause or the result, but anyway, at this point, it is still listed as a cause. We have ADPKD, the glomerulonephritis, lupus, IgA, so forth. Drugs and medications are very, very important. So I think this is one again, there are a lot of over-the-counter medications like non-steroidals. Even though they're over-the-counter and we think they're safe, they might not be that safe for your kidneys and other organs. Even though we're talking about transplant today, and I spoke to one of my patients and I told her our job is to preserve your kidney function for as long as we can and hopefully completely stop the progression. Because if your kidneys are one of the main organs that get metabolized and get rid of drugs and other products. And a lot of times, if you have advanced kidney disease, that might limit what kind of treatment you can get. And that's also something very important to keep in mind. Now, the question that was asked is, when do you start thinking about kidney transplantation stuff? So let's look at the spectrum of chronic kidney disease. Stage 1 being on the left-hand side is the earliest, and stage 5 is like we call kidney failure. GFR is less than 15, and in this condition, you will need dialysis or transplant or conservative management, whatever is decided. The transplant programs normally will not evaluate or list you till your GFR falls below 20. So 20 is, and there are exceptions that are made to this case, but 20 is where we start the process. So let me see what the question was, and I think Dr. Sarkar might have answered that. 1 second. That's not the Q&A. Let's see. with polycystic kidney disease, when should we start looking for a living kidney donor? And I think what Dr. Sarkar answered is absolutely correct. It's never too late to start discussing about kidney donation. And let me elaborate on what Dr. Sarkar just said. So normally when your GFR falls below 20, in my practice at least, the patients get automatically referred to the transplant process, and they start getting evaluated. And so they have to be accepted as a recipient first before they start working up the donor. And most of the times people start looking for donors. One of the challenges that we have reached into this is normally we like to wait for transplant till the GFR is around 10, between 10 and 15, unless there's an overriding, because we really want to use the native kidneys as much as we can. Now, some of our recipients are pretty proactive and they get a donor right away. The GFR is 20. And then the transplant program comes back to me and says, well, Dr. Rastogi, we can't transplant this person right now. I mean, they have still decent amount of kidney function left. So then it becomes more of a scheduling thing. And then we have transplant patients sooner than probably they needed to, but there are a lot of things that go into that process, the availability of the donor, how the recipient is doing, and a lot of those stuff. So PKD, and the reason why I'm saying PKD is because in PKD, it's now kidney disease by itself tends to be silent. And that's one of the biggest challenges we have. We have no symptoms. It's like termites eating your house from inside till the house collapses. But PKD is a bit different, or ADPKD to be more specific, autosomal dominant poly. The kidneys are humongous and they cause a lot of symptoms. So in those cases, sometimes we have done earlier transplant than we would have done for other. But having said that, most of the time, as soon as the GFR hits 20, we start the transplant process and then you. But I think what Dr. Sarkar said, it's never too late to look for transplant. Why is that? Well, first of all, it's a process. Some people find a donor right away. Some people it takes a long time. So it's good to start working on that process. But the other thing is, and I'm going to bring in our next speaker here, it's Miss Colleen Flannery. And so Colleen Flannery is our what we call a voucher donor. And I would like her to share her story. You can see the halo around her if you look very closely, or sometimes maybe not even very closely. But Colleen's daughter is Caitlin, who's an amazing dietitian. She just got married. Her last name is actually Green, believe it or not. And that was not just pure coincidence. But Colleen, do you want to share your story, what a voucher program is and what you went through to the voucher program?
I do. That would be great. Especially dovetailing off of what you said, the question was, is it, when should I look for a donor? Well, as the mother of a daughter with PKD, ADPKD, in my mind, it's never too early to kind of let people know that this could be happening to you, even if it could be a decade away, whenever. So I was kind of doing this back in the day when she was first diagnosed about 15 years ago. I thought, okay, maybe it will be my kidney, but I also knew as I aged, I found out that, around 65, maybe 70, transplant teams would prefer you not to be, over 65 or over 70. And then Caitlin's need would be more like when I was in my early 70s, but maybe she would hit a need earlier, so I'll be watching. But I also knowing what I've learned about kidney disease, what people go through, I knew that I could do fine with one kidney. And so, but maybe Caitlin would need it. Well, then the voucher program came along. And so with the voucher program, I was able to donate a kidney to someone that would need it. And Caitlin got a voucher for a kidney and she could get a kidney from a living donor and not wait the 8 to 10 years, but she would have an opportunity to get the kidney, hopefully, and not go on dialysis, as she reaches end stage. So I was able to donate a kidney. I had the same experience Shauna had with incredible education support, great medical team, all the good things. I had to repeat a test, have an additional test, just because they are so careful with their donors. Also along the process, you're reassured if you change your mind, you can change your mind. You don't, need to go through, if you have any, they don't want you to go through if you have any reservations. So I just found the process to be a very good process. And then at the end, what I wasn't expecting, well, one of the things when I told Caitlin, and she said no, but I told her I'm doing it anyway, you need to take this voucher. When I told her, then later after she let it sink in, she said that it gave her a peace of mind, which, you know, being her mother, that gave me peace of mind, that she had peace of mind. What I wasn't expecting was after I donated my kidney, I just felt this new, just elation, connection to what's really important in life. I felt like I've always had that, but I felt like I had that in spades, and it's enriched my life. And I am just appreciative for the whole process. And so I would also tell people that are like Caitlin, who said, no, I don't want to take your kidney. You know, that was her, like, you know, gut reaction in the, you know, immediately. It is actually a gift for the donor to give a kidney, and everyone I've talked to that's here, that's a donor, and other donors I've talked to feel the same way. It enriches the life of the donor. It feels like a big ask, I know, from people that are giving, that don't want to accept a kidney, but accept the kidney.
Colleen, thank you so much for just who you are. I mean, just your smile. And I still remember when you come and see me, you know, your heart, you know, you're crying from inside and even outside, but you had that big smile on your face. And Caitlin is so. But Colleen, if you can just hold on for a second, because I do have some questions for you. But we have two other guests who might be leaving. Andy Green, I had mentioned, is Andy around, or?
I'm here for about 2 more minutes.
Okay. Oh, hi, Andy. Hi, Judy. So Andy, do you want to say a few things, a few words?
Sure. Hold on 1 second. Trying to see. You can see me okay, right? Because I can't see me.
Oh, yes, we can see you. It's fine.
Great. And Judy, hi, Judy. So what did you want to ask?
No, I just want you to speak. Just whatever's on your mind, Andy. You've done this before, and I know transplant games are big on your mind.
Yeah. Well, I mean, a lot of the donors are here, and they can tell their stories about being a donor. Colleen always says everything I would have said about it being a gift to the donor, and so I guess what I could do is just talk about the games, if that's okay.
Yes, absolutely.
And let also Judy can tell her story, which is a little bit intermingled with mine, so that's fine. The Transplant Games of America, I was supposed to attend them a couple years ago, but then COVID came. They were in New Jersey, and they are held every 2 years somewhere in the United States, and people from all over the US who are donors of any kind, not just organ donors, but you know, skin and eyes and all kinds of things, and recipients. They compete in all kinds of events. This year, we're lucky enough to have it right here in San Diego. It's July 29th through August 3rd. And my passion, what I've been doing for 2 years, is playing pickleball. So that's what I'll be competing in. I've connected with a couple of other donors in the San Diego area, one man and one woman who I'm going to pair with and play mixed doubles and doubles. So I'm really excited about that. So that's just one layer, another layer of something that has added to my life. You know, another benefit of being in this group and just being a part of this world. So I just would encourage everyone to, if you're there, come and see us and support us, or join in. If you don't have to be a great athlete, they have things just for fun, and it's just going to be a really exciting time.
Yeah, and Andy, I just want to say that we will be in the Core Kidney team. Will be there with Andy. Andy's actually representing the Core Kidney program along with Mark and several other people. So please do join us. And supporting, but also this is, I think, a great statement on donation as well. You know, how healthy and good. When was your transplant, Andy?
All right, 5 years ago, February.
Okay.
And I'm glad you brought that up, because just recently I got Medicare, and I changed over to Kaiser, and they gave me my very own nephrologist just for fun. And I went through all kinds of tests, and I'm totally healthy. And I felt so good about that, because I just never felt better, really. So 5 years later, it's good. I'm happy.
No, thank you, Andy, and thank you so much for being such a big advocate. And just to the audience, if you are looking for a donor, or if you have a donor that has any questions, I think a picture worth 1,000 words, but Andy and our team worth a million more. Reach out to us anytime, and this is what Circle of Core does: is patient advocacy and support. And the key thing is you'll get the right answers. This is not going on the Google and getting a very skewed, bits and pieces of information, but this is really balanced, backed by UCLA. These are all UCLA ambassadors. So it's a very fair and balanced, and that's what you need, a very fair and balanced. There are, for every 6 donors who come forward, only one gets through the process. And I know Colleen had her own challenges because I was her, happened to be her evaluator too. So we'll come back to what Colleen went through. But Andy, thank you so much. The Core Kidney team is going to be in San Diego. And just the shout out to the audience, if you want to support us, please let us know. The more people that we can get to San Diego, the better it is. So please do reach out to us. So thank you, Andy. I know you have to run, but thank you so much for being over here.
Great to see you guys. Bye.
Bye for now. And Judy, how about your story for a bit as well?
Well, my story is Andy and I have been friends for decades, and she donated to one of her friend's wives who was O negative and had trouble finding a kidney. And I watched Andy go through this process and saw how it inspired her, how it changed people. And I secretly kept that information, and I just mulled it over again and again for probably about 2 years. Before I took the step to become a donor myself. And as Colleen had said, it was probably one of the most rewarding things that I've ever done. Not that we do this for ourselves. I am a advanced donor. I named my brother-in-law as the recipient of my voucher. And I'm happy to say, or actually I'm sad to say, is he is in the position now where he's going to be needing a kidney. But my goodness, because the amazing work that you do, Dr. Rastogi, my brother-in-law is on a 3-month waiting list.
Oh, wow.
Instead of years. And I think when we donate, us advanced donors, we never know. We just throw trust to the wind and we think, well, if you ever need it, whatever, it's here. When that moment comes, it is the best insurance policy that anybody could ever have. And it just gave me such peace of heart, peace of mind to know that my loved one, if he ever needed it, would have what he needed. So, and also just want to echo the amazing work and care that UCLA provides to all of its patients, its donors and recipients. You're changing the world. Thank you.
You are changing, Judy, and we are. That's what the Core Kidney mission is. And I always say the biggest gift somebody can give is a part of them, and these are our donors. But even beyond that, Judy, you and Colleen and Brock and everybody else who's here, the gift keeps giving, because it's not that you just gave your kidney and went on with your life. You're here to educate people, to give them hope, to show them the path to hopefully, like you said, the peace of mind that people have. And that's a term that I think Colleen used as well. I do want to mention about this voucher program, because, a place where I personally think that's quite relevant is that if there is a potential donor you have, but you think that by the time that you might need a kidney transplant, they will be past a certain age that they can donate, and this is their time to come forward. And like Dr. Sarkar said, it's never too early to, now having said that, I had a bit of, and that's what I think Colleen and I got into. I've never seen Colleen get a bit upset, but I got that look from her because I don't like my patients to think about dialysis and transplant very early on. And the reason is very simple. Our job is to prevent your native kidney is still your native kidney. And that's always the case. And the second best option if you have advanced is transplant, but your native kidneys are still what you should have. And when people start talking about dialysis and transplant in very early stages, I just think that they are probably not going to be compliant or adherent with what they should be doing and being proactive. But I've changed a bit. I think it is time to think about that. I think Colleen changed my mind a bit. I think that look that she gave me that day, but and then Judy and and there are ways to ask because obviously it's a difficult ask. It's a very uncomfortable ask, but there are, and we will be going over that a bit today if we have time. That what would be, and I think Mark would be a great person. But Judy, I just want to thank you. Thank you for all that you have done. You inspire all of us. We are making changes, but there's still a lot to be done. So thank you. And I'm sure Judy will be around. So if you have any questions, feel free to ask her. Colleen, anything else from your end? I still remember, when I said that Caitlin might never need a transplant, and your response was
that that I could help someone else. That
yes.
way,
So
knowing about kidney disease.
And that's the kind of people you're seeing over here today. Is so I said Caitlin might never need, and Colin said, well, then somebody else does, and somebody else did get that kidney transplant. So thank you so much, Colleen. Any questions more that are coming up? I think I answered the question that came for ADPKD. I think there was also a question about removal of the kidneys, and let's see if that has been answered. This question has been answered live. I
ended up typing it, Dr. Rastogi.
I'm sorry?
I ended up typing it. I'm sorry.
Oh, perfect. Great. So do you want to answer that question, Dr. Sarkar? So the question is that when you get transplanted, what happens to the native kidneys, your original kidneys? And this might not be such an important thing for people who have small shrunken kidneys, but people who have big kidneys like ADPKD, it becomes a real estate issue in their abdomen. So Dr. Sarkar, if you just want to answer that, that'll be great.
Sure. So usually the norm is not to remove your native kidneys at the time of transplantation. However, when it comes to PKD kidneys and your kidneys are extremely large or they're causing you pain, the surgeon can consider removing or doing a simultaneous nephrectomy at the time of transplantation. Now, this comes from the philosophy that, a transplant surgery in itself is a lot of hemodynamic or blood volume change between compartments of your body. So they would not attempt two big procedures at the same time. And the patients are followed very, very closely post the transplantation process and taken care of these things. Like people from ADPKD have these cysts that can get infected once you're on all these immune suppressing medications. The kidneys are getting larger, they can cause you pain. But long and short of it would be until unless the space is short, or if there's a very large kidney in there, the surgeon would not touch your native kidneys. They would want to get as much function from the native kidneys as possible.
Great. And like Dr. Sarkar said, in elective cases, when it is decided to remove, they are done either before or after the transplant process. So it is, but most of the times we leave the kidneys, and the kidneys tend to shrink, even the bigger ones, once the transplant process has happened. So hopefully that answers the question. Thank you so much, Dr. Sarkar. I also want to bring on our other kidney donor today, who's on, Mr. Brock Hall. Mr. Hall, if you can come on as well. So I think everybody knows Brock by now. So Brock, when was your surgery? I think you're muted, Brock, I think. I think it's still.
I'm
Oh,
sorry.
now we can hear you.
Oh, good. Okay.
Yes.
My transplant surgery was August 25th of 2020.
2020.
Right in the middle of the pandemic.
And I know your recipient is on today too. I think it's Alex is on.
Oh, very good. I didn't see his name.
He was on this one too. But sorry, go ahead.
I was going to say another PKD patient, and we met. It was about 20 years ago, and I met him. He explained he had it. I was like, oh well, when you need a transplant, let me know. You can have one of mine. So it's never too early to talk to somebody about transplant.
Yeah.
Get those donors lined up. And, he has 3 kidneys.
I think Brock, your voice is a bit low in volume, I think.
Sorry, I'm technical difficulties.
No, it's better now.
Keep my hand on the cord. What can I share with you, Dr. Rastogi?
Oh, yeah. No, so I think, Brock, you mentioned, I think that's an important point that it's like Dr. Sarkar said, it's never too early, but at the same time, not losing sight of preserving your kidney function.
Absolutely.
But
we waited 18 years before we
wow.
went to the surgery. So yeah, we took our time and did it when the time was right. And they were amazingly thorough in making sure that I was screened thoroughly. And we joked along the way that once the process started, that this was about me and my health, so much more than his, because they just wanted to make sure that I was going to go through with the least amount of risk possible. And the UCLA team took care of me unbelievably well, and Alex as well.
No, Brock, thank you so much. Like I said, all that you have done, which people don't, probably don't know, how much you have helped other people in the process as well. And once again, if once to our audience here, if you have any questions, you can just reach out to us. We'll connect you with Brock. If you want to donate yourself or you're looking for a kidney donor, I think there's no better, people to talk to than our kidney donors. So Brock, I once again want to thank you for all that you have done and keep on doing. So thank you. Very grateful.
Lucky to be here.
Thank you, Brock. The psychology behind, the psychology behind living kidney donation, the psychology behind transplantation, psychology behind, any chronic illness. And I would like to invite my colleague, Dr. Jim Cunningham, if he's still here, if he wants to say a few things, especially with this COVID pandemic, which hopefully will become an endemic with an end to emphasize. So, Jim, are you here? I see you in the panel. Okay, I think we can move on. Mary Beth and Gerald are 2 recipients. Mary Beth is our she got her kidney several years ago. And then the first thing that she did was she climbed the Sydney Bridge. I think. Christina, can you get Mary Beth on? Let me see.
Unmuted.
Oh, all right.
Yep, I just saw that, Bill. How are you? How
Good,
are you?
good. How are you, Mary Beth?
I'm very good. And my message is listening to all these people who donated that, I received a kidney right when I turned 70. And so many people could not match me. And I'm just here to say, don't give up on deceased donors. I received a kidney from a deceased donor. I'm now 75. And I said to Dr. Rastogi, if you want to give everybody hope, I remember I got my transplant. I was shocked from a 29-year-old who was 6'7". I'm 5 feet tall. So the whole thing really was a miracle. And I remember saying to Dr. Rastogi, do people really get kidneys? And say, thank you very much. I will see you later. So I joined this Circle of the Core, amazing group of people who are my inspiration. So whether it's a matched kidney, a family kidney, a friend, or a deceased donor, you know, I feel like my life changed and I got a new purpose. And what Dr. Rastogi teaches you, how to turn pain into purpose. So there's hope out there. Turn your pain into purpose. We got the boxer, we got everybody here. And we really want to reach out and to inspire you that not to give up hope. There's always hope. You just have to have the mindset. Take care of yourself and stick with UCLA. It's an amazing place.
Thank you. Thank you, Mary Beth. And your stories are all over the internet, but I just want to say that you inspire all of us, including me. So thank you. We truly appreciate that, Mary Beth. And our next guest is going to be Louis. So Louis' story was just shared by UCLA Health. And just to summarize, a very inspiring story for multiple reasons. But Louis, do you want to say a few words? Because you are at a different, side of this whole story.
Yeah, I'm what you would call pre-transplant, I guess. I am at stage 4, teetering on stage 5. As of now, I haven't received my new labs yet, but yeah, I am. First of all, I am so happy to be a part of this group. It's changed the lives of not only me, but my family. We will always be eternally grateful to you, Dr. Rastogi, and the program for doing what you've done, and your guidance and your mentorship now to me has just made this process a whole lot easier. I found out in November of 2020 that I was at stage 4. And it was devastating, obviously, for myself and my family. And my wife and I searched, and did tons of research and tried to figure out how, to see if there was a cure, what I could do to better myself, or, ease the not only the mental but the physical, symptoms that I was having. And I think, one of the big things that we found is that, changing my diet, from to an all plant-based diet helped out a lot. It helped stabilize my condition, so my numbers didn't drop as quickly as they were dropping, because they went from 41 in January to 20 in November. So it was a pretty dramatic drop in just a few months. So, but not until I found the core kidney is when, I think all of our questions were answered. So, having the support, not just of Dr. Rastogi, but people like Mark and Colleen and Christina, and, we just have, such a great group of people that are willing to help. And I say that, that we want to offer that help back to people that are, not necessarily in the core group, but that can get a hold of us through via email, social media, what have you. We have, I'll be happy to answer anyone's questions, that are going through what I've gone through, or that have, the same diagnosis that I had, and are trying to figure out what's going on, and help them walk them through. Just like when I met Dr. Rastogi and I met Mark, and I had an hour and 2-hour conversation, and that really helped out. So the support part of it is definitely something that I emphasize that we have. It's an amazing support group, but we offer that to everybody, not just the members of the Circle of Core. So that said, I think it's an amazing group of people. I feel before when I was diagnosed, I was hopeless. I felt hopeless, and now I feel, like I could, take over the world. It's just an amazing feeling that I have to be a part, and to have the doctors at UCLA, not just Dr. Rastogi, but all the doctors and the team that he's assembled for my overall care. You know, changing my primary care physician and my cardiologist, and you know, pretty much handpicking everybody for me to you know, make sure that my condition is very well monitored, and you know, I'm going to be taken care of. So that's the amazing thing that we are able to, I guess, achieve with the core, and obviously offer it to people that are on this, that are listening to this or watching this, the support and the guidance, and again, you know. But another thing that I would like to say is being your own best advocate, like Dr. Rastogi said and Mark said, that's like the most important thing is to, you know, ask questions, get your labs, check your labs, learn your labs, you know, make sure you're adjusting your diet accordingly, talk to your dietitian. There, all these things that the core offers and the UCLA doctors help you with, you know, it's almost just like an email away. So if you have the doctors at UCLA, you could email them and you get an email response that same day. So that's something that prior to coming to UCLA, I didn't have any of that. So with that said, I guess I'll throw it back to you, Dr. Rastogi, and just thank you so much for everything you've done for me and my family, and introducing me to all these amazing people that have changed my life, that are inspiration. I can't even tell you how much of an inspiration everyone has been that I've met so far. So thank you.
So Louis, first of all, thank you. I don't know if we can post Louis' stories link in the chat, or we can email, but Louis' story was very powerful. It was actually shared by UCLA Health. And normally the stories are 1 or 2 minute reads. His was 9 minutes. So that's one of the longer stories that I've seen. And if you haven't read his story, I would strongly urge you to go and read that, because talking about inspiration, there's a whole different side of Louis' story that is really transformational. The other point that I want to mention about Louis, and when I spoke at Louis, is that also taking ownership of your health. You know, our advice is only as good as what you do. I mean, I can tell you do this, but if the patient doesn't do it, it doesn't really get you anywhere. And I think what Louis, an example, and I know we have Alex on here too, but I was having, the first time I met Louis was at one of the restaurants, and Louis is now a vegan. And I was seeing what he was eating, and he made sure that he stuck with his vegan diet. So diet is very, very important. And we have two outstanding dietitians that I think all of you know. It's Shima and Rebecca. And I think if both Rebecca and Shima can come on screen for a second. Today, we are talking more about transplant, but we will be, the next event is going to be, if we can get, is Dr. Joanna Shainman. She'll be talking about COVID vaccine and COVID-19 itself, the update. That is most likely going to be May 1st, but if not, and Rebecca and Shima will be talking about diet in our future events. If not May, it's definitely going to be June. But I think one place where we didn't touch about kidney donors is that why are people declined? And there could be absolute declines, that you have an illness that will preclude you from being a safe donor, period. And that is not going to change. But there are other relative ones too, like you might be a bit slightly overweight, your blood pressure might be slightly high, your cholesterol might be a bit high, your sugars might be a bit high. And those are things that you can work on. You'll be healthier, period, irrespective of whether you donate or not. And that's where our dietitians really are very impactful. So Rebecca, I know you came on for a second, and Shima, but if you just want to say hello to there's Shima, and I think there's Rebecca. So I think you have seen both of them, outstanding dietitians, outstanding human beings, in my opinion. So Shima and Rebecca, thank you so much for all that you have shared. You know, we have And I know Shima and Rebecca were answering some questions too in the chat box. We're trying to answer as much as we can, but Shima and Rebecca will be doing their own sessions soon. They'll be talking about the diet for transplant patients. If you are have been transplanted, what kind of diet you should have. If you are going to be a living donor and you want to modify your diet, we'll talk about that as well. If you are pre-dialysis, CKD, what kind of diet? So we'll be discussing that more as well. So Rebecca and Shima, if you want to say a couple of words to our group
I thank you so much, Dr. Rastogi. And I know 2 days ago it was National Doctors Day, so happy National Doctors Day. I'm very thankful that I can be a part of the core kidney group, and just like everyone in this chat and all the participants that are here with us, I'm also continuing to learn with you all. It's definitely a process, and that's that's part of it. Just kind of learning and understanding your body. I'm just very thankful that I can be a part of the team, and I always look forward to just speaking with all of you, because we know how important medicine and nutrition are when they're together. So it makes a really good team. And yeah, thank you. Thanks, Dr. Rastogi.
And thank you. Shima's going to say a few words too, but then I'll speak about the two of you, what I think. So Shima, you want to say?
Hi, everyone. Thank you so much. Like Rebecca said, this is an amazing team. It's a pleasure to be part of this. It's an honor. I know sometimes all these kind of different things, diagnosis can be a little bit more confusing because everybody always there's tons of misinformation out there that I always talk about it. And we're going to definitely talk about it next month. I know for especially kidney donors, because I work at a transplant center too, sometimes the education is lacking. So just one thing, like Dr. Rastogi mentioned also, sometimes you're going to get refused for the transplant or for the donation, and they tell you because your weight is high, don't get discouraged. It's always a way. We work really closely with you. Don't worry about it at all. It's not like when one door closes, the other one opens. I promise you, because I see tons of different patients every single day that they want to donate. And then I know some of them, they get demotivated and discouraged. That's why we are here. So don't get discouraged at all. Thank you so much, doctor.
Yeah, thank you,
everyone.
Thank you, Shima. Thank you, Rebecca. And I just want to say once again what I said before: people who come and speak in this are vetted, are people that we personally trust. What their opinion is unbiased, and Rebecca and Shima stand for that. They give a very balanced, fair, and balanced opinion. You might not like what they say, but it's going to be fair and balanced. And I was giving a talk to a group of nephrology providers, and there were a lot of pharmacists, and one of the questions that was asked is, what's the role of a dietitian? And I cannot stress the importance of the role of a dietitian, a good dietitian, somebody who understands the pathophysiology, and somebody, like Shima said, can work with you. We as nephrologists tell you what you cannot eat. They tell you what you can. And I think that's really the big difference that I can see in what's healthy for you. So getting a good dietitian is very, very important in your overall health, and not just for the kidneys. And this is important. I always say it's not just the kidneys at the end, it's the cardiovascular system, it's your heart that gets you. So whatever you're doing is not going to benefit just your kidneys, but also your cardiovascular system. And you'll be so much better off by doing that. So Rebecca and Shima are always on. They come every month. Today we were just focusing on transplant. But if you have any questions, email us. We are starting something called Ask Our Dietitians, and we'll be posting those questions on our website. So that's also something that we're thinking of doing in the near future. But till then, you can ask questions live. And if you would like to get a private consultation, I would strongly recommend that you do that. It will definitely make a big impact. Number one, in your disease state, but also the number of medications that you might be taking might also be altered. So with that, thank you, Shima. Thank you, Rebecca. And thank you. I think, Rebecca, you're still in Florida?
No, I'm in California.
Oh, you're back in California? Okay. Welcome back. Okay, thank you, Shima. Thank you, Rebecca. And talking about the other important aspect of our care is your mental health. And I know you have heard from Dr. Cunningham a lot, but I just want to bring him on for a few minutes that he can give his take on transplantation. There's a lot of psychology behind kidney transplantation, especially living kidney donation. So, Jim, if you're back here, if you can come on. There he is.
Hi there. So, in terms of giving a clinical perspective on it, there's a lot, I think, that can be said. But for me, the real educational piece comes in from listening to the testimony and to seeing, in a lot of instances, what the recipients say after they go through the process. Because I'm in, I guess, neither predicament. The most powerful thing, or a blueprint, if you will, I think for me, is just listening to the testimony. Yeah, we can sit here and talk all day about the psychologizing about it, the accountability and the structure and, being accountable for your BMI and all of that. But I think just listening to these stories gives me a profound amount of insight and humility and just gratitude. I'm sure that's what most everybody takes from these, but I continue to get deeper levels of an understanding every time I hear somebody witness or somebody talk about their experience, whether they're a donor or a recipient. So, yeah.
Any questions for Jim? And one day, Jim, you need to bring your dogs on too.
Okay.
I know pet therapy, especially in this time, is very important. Yeah. So I think that would be very important as well. So thank you, Jim. I mean, thank you for all you and you'll be on for all these events. You have provided such great. But I do want to mention a couple of things before you leave. Depression and anxiety are very prevalent in patients with chronic diseases, whether it be kidney disease, heart failure, diabetes, and complicating from that. And we are looking into that at UCLA. We are doing active screening in stage 4 and 5, and also in patient dialysis. So the reason I bring this up is that mental health is so important, and it's to get help from the right people. So Jim, I mean, I know you've seen a lot of my patients, and you have done wonders with them.
Can I interrupt, Dr. Rastogi?
Absolutely.
I'm sorry, I don't mean to interrupt, but I'm actually, Jim and I've started my sessions with Jim, and the psychological part, it is so important to have somebody like Jim to talk to and to help you mentally, give you methods to cope with what we're going through, because no one really understands what we're going through. And people like Jim that have worked with the Corps and worked with, Dr. Rastogi for so long, understand what we're going through. And he's given me so many tools to help me, not only myself, but help my family get through this. And it is so important for anyone that's going through this to talk to somebody about it, because it will help you, and it will help you be a better person. And the dark days that you have when you're diagnosed, they get a little brighter. So that's all I wanted to say. And I wanted to thank Jim for being there to help me get through this as well. So.
Thank you, Louis. Thank you. That's a very nice thing to say. And Dr. Rastogi, I didn't mean to gloss over the, anxiety or reactivity piece of, the way we clinically treat kidney disease. But I think these stories somehow supersede, and, that is a big part of it, to walk people through those steps. But by the same token, I think the stories kind of allude to that. So.
No, Jim, I didn't say that you glossed over that. What I was saying is that I think what you have done to our patients, I'm very grateful. I've and I speak about that nationally and even internationally, is how to manage chronic illnesses. And we have the mainstream, we have physicians and surgeons, and they give you medications. But are we really dealing with the main issue? And a lot of the main issues is psychology. A lot of times we end up in these problems because, we didn't take care of ourselves.
Yeah, and that's why the accountability and everything we preach in these sessions and we go over, I think, is so important for people to, it sounds very basic, but I think people have to be reschooled and they have to rethink, and they constantly have, it's a foundation.
Yes.
Yes. A foundation. It has to be solidified. Yeah.
And I can just tell you by the way I practice, at least, is one of the foundation, what I would say, expertise that I utilize is psychology. I always try to get into, and we spoke about dietitians and diet. Jim, you're saying something?
No, I just agree with you. It's between the ears. It's 90% of it is between the ears.
Yep. And also, Jim, you're also a physical trainer. You're also at some level, look into diet as well. So I think like I said, Louis spoke up. I wasn't even aware of that, but how much you have helped some of our patients. So getting to the right psychologist is also, so I think one of the point that I forgot to mention is what Louis said about getting the team. It's not one person. If somebody says, I won't take care of you, I think it's just not correct, unless you just have a cold or something. For chronic illnesses, you have to have the team, but it's not just the team, you have the right people in the team. And I think that is key. And what Louis was saying is absolutely right, that getting the right team, the team who communicates with each other, and things 5 steps ahead, not just what's right here. So I think that's where planning. Louis came to us when they were told he's going to be on dialysis, but there is a very good chance that he will get a preemptive transplant. He will never have to go through the dialysis process. So this is what we call planning. So planning is very important as well. Now, I know I've spoken enough. Jim, any parting comments about COVID? I know you'll be back at our future events, but hopefully we're coming out of this at this point.
Alluding to the conversation we had a couple of days ago, what I'm finding is there's kind of, and I don't want to get too metaphysical about this, but I think there's a new, unless of course we have another variant, I guess I should qualify it by saying that. I think people are moving forward, but I think the trauma and the damage and the disconnectedness and the way people kind of, some people didn't take care of themselves during COVID now is kind of coming home to roost. And I think people are starting to move in a different direction, I guess, is what I'm trying to say. And so that being said, I think there need to be new tools for that. And, I don't know if we are any longer by definition in a pandemic. I think we still are, but I think it might be moving to a different stage, and people are understanding how to live with it, because it seems to me like it's going to be here for a while. So,
yeah. We just have to live with it. I think that's, I think we're coming out of it. But Jim, thank you so much. You'll be here for all our future events, and also if somebody wants a consultation with Jim, just please email us and we'll connect you. It's worth every single second to speak with him. Before we were getting close to the end, I just wanted to do a couple of shout outs. I know Mr. and Mrs. Lewinson are on today, very dear friends of ours. And thank you so much for commenting. I also know Vernita is on as well. She has been commenting. We're going to set up separate meetings. There's so many people that come together, and there's so many more that I won't be able to say everybody's name. But thank you everybody for joining. In the closing sections, I will ask our co-host Mark to come back and also introduce Gerald for a second, a very dear friend of Mark.
Thank you, Doc. Thank you, Doc, so much. And for everyone who's on here today, I really emphasize that it is National Donor Month, and you've heard all the stories of the people who stepped forward to give people like myself and everyone fighting kidney disease hope. We had a voucher donor, a direct donor, all these different donations in the process of helping people like me and all those 33 million people who are diagnosed like Louis. And it's really amazing how this community has brought that support, the emphasis of hope, the patient advocacy portion. And this is where I come with Gerald. I met Gerald through social media, through sharing my story. And he went through the UCLA transplant evaluation. The first time I met him, I was actually on dialysis. Literally, he came into my dialysis chair. I said, "How are you doing, sir?" We shook hands. And then he went through the process with me. The next time I met him was actually the second day recovering from kidney transplant at UCLA. And that was one of the first pictures you've seen in the very beginning, where I met Gerald for the second time. But this is what the Core Kidney organization is about. We're here to support each other, and we might not ever meet each other, right? Some people will call us over the phone and they want to hear the story so that it can give them the hope. But this is where Gerald came in and really, really made sure that I was on head straight when I went through the process of dialysis, through the kidney transplant, and now us being colleagues working with the Core Kidney program. So without further ado, I'd love to bring on Gerald to give him his story in light.
And also, Mark, before I forget, there's
Yes.
a question saying that can you talk briefly how to ask for a kidney? So after Gerald has spoken, if you can just spend a few minutes on that, and we'll definitely dive into that later on.
Of course.
So there he is. Hi, Gerald.
Hi. Thanks a lot for that, Mark. Can I just say that, just how wonderful it is, to be surrounded by just amazing individuals that, have, some powerful stories. And like Shauna had mentioned in the beginning, I think for me, I'm a kidney recipient. I think it's almost impossible, not to wake up every day and be, like she said, present and humbled and grateful, I think, for that second chance at life. I think, the common thread, I think, throughout today's session, I think, something that, connects us all is, we all have stories of, gratitude, hope, faith, and never, giving up. And, just I think on that end, I definitely want to thank, Dr. Rastogi, Christina, for, providing each and every one of us, this amazing platform where we can share a little bit about, who we are and a little bit about our stories and give hope to people who are going through some of these similar things. And I think, what's amazing is we all come from different backgrounds, but once we meet, we automatically connect. There's that immediate connection, that immediate love for one another. So I know that, just we're coming to an end, but, that's really all I wanted to say for me. Just it's so wonderful to see you, Mark, doing, great things for the Core community, and, our Core Kidney program here at UCLA. So, all I can say is, just reach out, and with your questions, we will be happy, to talk to you or to give you, those words of encouragement. I think, because, it is true. I think, in terms of mental health, this is a thing that, not a whole lot of people talk about, but, we all go through it, loneliness, depression, feeling like, we're on an island and, there's nobody else that we can talk to. So, I thank I thank everybody in this group, each and every day, because, just this is what I needed when I was going through, transplant myself, as somebody, group who will support me, who will walk me through the steps. So, so thank you for the time.
Well, thank you, Gerald. Thank you for all that you're doing, actually, and thank you for visiting Mark when he needed you the most. So very much appreciated. So Mark, we need to wrap up soon. So if you can just go briefly, for a few minutes, and then I just want to mention to the person who asked that question is we will do a much more deeper dive into this about how to ask for a kidney. But if you can give a few lines.
Of course, Doc. So here's what I would suggest to a lot of the patients that I do talk to, whether it's social media, is tell your authentic, true self story, right? And there's people who want to help, they just don't know how. And through the process of me going through this kidney evaluation, getting a kidney transplant, there were people who helped me out emotionally, financially, friendship, just hearing me out. You just have to share your story and you'll be surprised who's willing to come forward to help you out in any way. And for that, Doc, that was the 2 sentences that I've learned through the process of the kidney donation, the kidney transplant. And if there is any more information, would be happy to answer them in our emails that was actually presented in the beginning, and we'll give you more information on that.
Great. Thank you so much, Mark. And I think there was a question about how to get in touch with our office. I don't think anybody has answered that yet. But let me see if somebody has. So I think the question was asked. I'll put that number. I don't. 542-692. There we go. But anyways, I want to thank everybody for attending, all the attendees, all the participants, everybody who's presenting. I wish you everybody the best. Last month was Kidney Month. This is the organ donation month, but every day is Kidney Day, and we just need to get the fight going over here. Kidney disease is silent. It affects a lot of us, and a lot of times we don't even know. So there are a lot of options available at every single stage of your kidney disease. So we're here to help. If there's anything else we can help with, please let us know. We'll see you definitely next month. Our program, the chat, is first of every month, 5 to 6:30 p.m. That's what we have set. But there are other events too that we'll be doing. We mentioned the transplant program. We also mentioned, and Mark is doing the lead on this whole event in Panorama City, Mark. So we'll be sending out more information about that as well. So with that, thank you very much. Please be safe, and we'll see you soon. So signing off for now.
Thank you, everybody.